Welcome back, 9:19 this Tuesday morning. Well, if you've ever had trouble winding down and falling asleep at the end of the day, you're not alone. Many people turn to natural remedies such as melatonin to catch some Z's.
This morning we're joined by Dr. Paul Berger with Sanford to discuss some of the effects that come with taking melatonin, maybe on a regular basis. Good morning.
Hey, good morning. Thank you for the invitation to be here.
So talk a little bit about melatonin and kind of maybe for those that don't know much about it, kind of what it is.
Well, melatonin is a hormone that is naturally created in a portion of your brain called the pineal gland, and it's also created in your gastrointestinal tract. But the melatonin that's created by your brain is used to maintain a sleep-wake cycle and to maintain certain circadian rhythm within your body. And so melatonin will start increasing as daylight starts decreasing, and it will start decreasing when daylight starts coming around as far as the morning time. So it's key to the sleep-wake cycle.
And can you tell us, if you're taking a supplement of melatonin, what effect that can have on your body?
Well, as far as short-term effects, there are some people who have what would be referred to as acute insomnia, so difficulty maintaining sleep or difficulty initiating sleep. And so taking a small dose of melatonin 30 minutes before bedtime may have some benefit to help promote sleep. But with regard to any long-term chronic use, there's not really any good data or any good trials that really suggest what the overall risk factors are with long-term melatonin use. But that being said, if you're using melatonin for longer than a few days to a week or two, then you probably should be evaluated by a sleep-trained professional, because there are some other issues that could come about with temperature dysregulation, blood pressure issues, and also issues with control of your blood sugars.
Yeah, how important is sleep and making sure that you're getting good sleep? And maybe do you have any other natural remedies that you would recommend people try versus melatonin maybe?
Well, sleep is incredibly important to your overall body's management of all of the body functions, and as well as maintaining mood, behavior control. A lot of your body's healing occurs during the times of sleep. In order to try to foster a better sleepful state, then oftentimes avoidance of caffeine, alcohol, trying not to eat, getting closer to the time of bedtime, maintaining a good structured bedtime schedule, quiet, comfortable place, and avoidance of bright lights, blue lights on your cell phone, turning off your LED TV. Those kinds of things will help promote sleep.
And as far as, I know a lot of people like to use melatonin for their children as well, helping them wind down when it comes down to bedtime. What are some alternatives you could use for children?
Well, for children, if you're looking at using any kind of supplement, so it's important to say that melatonin is not really regulated by the FDA, because it's considered a supplement in the United States. So when you're purchasing melatonin, you're not necessarily guaranteed to have the same amount of dosage. You're also not necessarily guaranteed to know what other adulterants are with that tablet that you're taking. When it comes to children, then really you need to be speaking with your pediatrician or your child's doctor and have that discussion as far as what you might be able to do as a parent to keep that structured bedtime, to keep them on a schedule, and work on some cognitive therapies, or make sure that you've got a quiet, dark, comfortable place for the child to sleep.
Awesome. Well, thank you so much for being here this morning. We appreciate you joining us.
Absolutely. Thank you very much.
Yeah.